There's never a good time for a headache. They always seem to come at a bad time. They're frustrating, annoying, they can be debilitating for some, and that's not even to mention the associated symptoms. Pain, throbbing, a vice grip around your head. Some of you might experience nausea, dizziness, ringing the ears, head fogginess, and even concentration issues. Headaches prevent you from living a high quality life. They affect your work, your hobbies, your family time, your sleep. There's nothing they don't touch. If you suffer from headaches, I know exactly what you're going through. In this video, I'm going to show you how to get rid of your headache fast. Let's get to it. Find a comfortable seat so you can get in a relaxed position so you can follow along and get the best results in the shortest amount of time. The first thing we're going to do, we're going to focus on two important acupressure points. The first acupressure point I'm going to show you is large intestine 4. Very simple, or it's between your thumb and your index finger. You're going to come in and squeeze on both sides. You're going to search around for a tender spot, and when you find it, I want you to stay on that area with some sustained pressure, or if you'd prefer, you can do a circular motion, clockwise or counterclockwise, but find the tender nodule. You'll feel it because it is quite tender, and sustain that pressure for 15 seconds. In order to keep things balanced, I want you to do it on both sides because you might have a bit different effect based on if your headache is throughout your whole head, at the front, or on your left or right side. So again, you're going to search around, you're going to find the tender spot and sustain pressure. When you know, you'll feel it, and you can either sustain pressure or circular motion. I want you to go back and forth between each hand, or each point I should say, twice for about 15 seconds. This point's really good for headaches, dizziness, nausea, but I find it one of the most quickest, easiest, and effective ways when I show patients to do this in my clinical practice. Okay, on to the next point. The next point we're going to do is called gallbladder 8. It's in your temporalis muscle, which is a muscle that fans on the side of your head. Now to find this one, what you want to do is you want to take the apex or the top part of your ear, and you want to go about 1.5 centimeters or 2 straight above the highest point of your ear. And the same thing, you can use 1 or 2, apex and up. Search around for a tender spot and then sustain that pressure. This one you can do 2 at a time, or both sides at a time, I should say. Or if you prefer, you can focus on one. But I always like to hit both sides, whether you do it together or separately, just to make sure you're not missing any potential benefit. Again, hold for 15 seconds. You can do sustained pressure, or you can do some circular motions. I don't have a headache now, but just doing this is very calming and takes tension out of my head and neck. And I'm sure you're feeling the same. And then you can rest and do it for 2 to 3 sets. For 2 quick points, I'm sure some of you are feeling relief already, but let's move on to the next exercise. Okay, we're going to move on to these suboccipitals, the very tight muscles that just come off the base of your skull. These muscles will sometimes be tight. There's a few sensitive nerves around there. When those muscles become tight, they refer to the head causing headaches. So all we're going to do is take our 2 fingers, we're going to drop them off of our skull, here. We're going to apply some pressure to that area, but as we do that, I want you to take your head and slightly pull down and chin tuck. So what that's doing, it's opening and stretching out those muscles. So we're going to find those points, apply some sustained pressure, slightly look down. If you want, you can rotate your head by using your thumbs on your mandible or jaw. Be careful not to put too much pressure on it. And then if you want, you can also traction up. So look at 3 movements. Find the spots, sustain the pressure, slightly look down and chin tuck while pushing up this way. So the movement's like this. You will feel pressure, and for some of you, you might actually feel a reproduction of the pain in your head. Now, that might seem counterproductive, but that will tell you you're on the exact spot. Hold this for 15 to 30 seconds. and then release. Let me show you from the side. So we're going to take our hands, find in the back of our head, underneath our skull, find that area. Take our arms, we're going to chin tuck down, and we're going to put a little bit of upright pressure while making sure you don't lose the contact of your index finger or middle finger on your suboccipital muscles. Again, hold this for 15 to 30 seconds. And again, one more time from behind, find the muscles. You're going to chin tuck and push up. For some of you, you might only want to focus on the suboccipital pressure, and that's completely fine because this next exercise stretch I'm going to show you is going to incorporate stretching those muscles. So this one will be very similar to what we just did, but our focus, instead of putting pressure on those muscles, is to actually traction and stretch them. So we're simply going to do the same thing. We're going to take our hands, we're going to come underneath our mandible, and you can put your fingers here on the same spot in the area, but our focus is going to be pulling up. The key here, though, is as we pull up, we're actually going to laterally flex to work one side more than the other. Hold this for 15 to 30 seconds. And come back to neutral. Again, whether your headache is on one side, both sides, or at the front, I want you to do both sides to keep things balanced because sometimes you don't know where the headache's exactly coming from. So a good way to do that is to do both sides. Again, we're going to come down, we're going to traction up, and as we traction up, we're going to laterally flex or try to bring your ear to your shoulder. Hold for 15 to 30 seconds. And come down. Let me show you that from behind. So our hands are going to come up, pull up, extend your head, and as we pull this or push to the ceiling, we're going to go to one side. Holding for 15 to 30 seconds. For some of you, you're probably starting to feel some relief already. However, for those that are not, you might need to repeat this process 2 to 3 times in a row and maybe do it twice a day to start to see how that will help alleviate and get rid of your headaches. And remember, if you want more specific and efficient help with your problem, it's always best to seek out local professional help. I appreciate you tuning in. I hope you liked that video. If you're new to my channel, you maybe consider subscribing so you can be informed when I upload a new video. If you have a question or comment, put that in the comments below. I'm going to answer that as soon as I can. I can't wait to see you in my next video. Until then, stay well.